Hello and welcome back. This is Dr. Sachin Patel with Thyroid Bootcamp. Today's topic, we're going to be discussing why thyroid medication is so hard to dose. And some of you might be blaming your doctors or the medication for the reasons you don't feel so good. But we're going to talk about some things today that you can actually control that might make your medication work better for you. One thing that we teach our clients is that in order for your thyroid medication to work, your body itself has to be working properly. The way thyroid medication works relies on your body functioning the way it's supposed to, and in some regards optimally, which sounds counterintuitive seeing that you have a thyroid issue, but your body has to be working the way it's supposed to be working in order for the medication to actually work. So we'll talk about that today. Of course, as always, we believe that nothing will fix your body better than it can fix itself, and that's why we put these workshops together so that you can learn more about how your body works, and therefore you can take some action steps to improve your health outcomes. So dosing thyroid medication is difficult, and most doctors will tell you this. One of the reasons is because there could be a conversion-related issue. Remember that T4 has to be converted into T3 in order to be in its active form. And when it's in this most active form, that's when metabolic function actually takes place. The conversion of T4 into T3 relies on nutrients such as selenium and zinc. So in order for that conversion to take place, you need the right nutrients to be present. Some people might also have issues of toxicity along with nutrient depletion that can create some problems as well. Number 2 is high stress. When you have high stress levels, this also decreases hormone conversion. Remember that high stress turns off the production of TSH and instead turns T4 into reverse T3, which makes it metabolically inactive. High stress will also change the way your medication is being converted, and instead of turning it into T4, it will downregulate conversion and or turn it into reverse T3. Number 3 is constantly changing demands. Your stress levels change on a daily basis. Your nutrient demands change on a daily basis, depending on the amount of stress you have, the amount of work that you're doing, the amount of sleep that you get, how many directions are you being pulled in. These are all things that change on a daily basis. Now, if you're taking the same dose every day and that's not changing, then that could be something that makes it difficult for you to dose, especially since your weekends and weekdays might be stark contrast with one another. Number 4 is autoimmunity. If your immune system is in the background destroying your thyroid, then your dose would continue to go up, or it might be difficult to dose because your immune system swings from one side to the other. And some weeks or days you might feel great, and other weeks and days you might not feel so great. And this is usually an indication of an autoimmune related problem. So not knowing that you have autoimmune disease such as Hashimoto's is very, very debilitating, because that's key information that's being kept from you. So we always encourage that you discover if you do have Hashimoto's by getting your antibodies tested. Number 5 is estrogen. This is why thyroid issues are more common in women. It's because of estrogen. Monthly, your estrogen levels will fluctuate with your cycle for your entire adult life. And also, our chemicals in our environment tend to be xenoestrogens. They tend to mimic estrogen function. Estrogen competes with thyroid hormone. And this could be a major issue and cause for the medication not working the way it's supposed to. Number 6 is the liver, the kidney, and gut-related issues. Remember, your liver, your kidney, and your gut have the responsibility of converting T4 into active T3. And if those areas of your health are compromised in any way, it's going to change the way your medication works. Number 7 is nutrient depletions. We mentioned selenium and zinc, but there could be other nutrient depletions such as vitamin A, which also lead to poor receptor site activity. It's very critical that you assess your nutrient status, because that will impact the way your thyroid hormone is converted and also the way it's received from a receptor site standpoint. So here's 7 reasons why it's difficult to dose your medications, and 7 reasons that you can in effect take control over. You can control stress levels. You can control your demands to a certain degree. You can identify if you have autoimmunity. You can reduce your exposure to xenoestrogens and estrogen-based compounds. You can improve liver, kidney, and gut-related function, and you can assess for nutrient depletion and start working on that as a strategy to help improve thyroid hormone conversion. So these 7 ideas should be very, very easy for you to act on and very critical in optimizing the function of your medication. I always ask my patients, would you rather take one pill and feel great all day, or take a handful of supplements and still get compromised results because you haven't addressed these foundational issues? And most people would rather take that one pill and feel great than have to take a bunch of things that they may or may not need. So let's use this as a guide, start working on some of these things to change, and let's see where you can get in the next few weeks. If you have any questions, we're always here to help. We're always here to support you. Please feel free to respond to this email, and we'll be happy to help you in any way we can. Once again, this is Dr. Patel with Thyroid Bootcamp, and I hope you're finding these videos educational and beneficial. Please feel free to share them, and we love to hear feedback, so let us know if they're helping you. Thank you so much. Have a great day.